In this video, we're going to go over the side-lying lumbar manipulation on a more guarded patient. So we have the patient laying on their side. Since the patient's more guarded, I'm actually going to have them a little farther back than typical, just so they don't feel like they're going to fall off the table. If patients are too close to the edge, sometimes their muscles guard up as a protective mechanism if they're afraid of falling. And when that happens, it is harder to perform this technique. So I'm bringing her leg forward. So straighten out your back leg. Off the camera, her back foot's off the edge of the table to make sure the rotational component's cleared, that the foot's not blocking rotation. So I have her already biased into the position. Excuse me for one moment. And then I'm going to turn her over. And then give yourself a hug. So I'm going to bring her hands down to here. I'm actually just going to take this hand and just use this one. So the difference for what I'm going to do versus what I normally do is I'm actually going to already rotate her, and I'm going to stay far away from the patient. This is very non-textbook for lumbar manipulation because every course you go to is going to tell you to stay in as closely as possible. However, since this patient's more guarded, it's more threatening if I'm standing closer as they feel that I'm getting ready to perform the technique. And then I'm going to pre-position her into rotation, and I'm just going to rock her back and forth. And while I'm doing this, I'm feeling her back muscles with this hand and just assessing if they feel tense and guarded or if they feel nice and relaxed. I'm going to do this for as long as it takes for her to stop paying attention, maintaining my distance the entire time. And when she's not expecting it, I'll go for the manipulation. And I can feel her muscles guard up when I said that.
Damn, Brad, sorry.